So my friend, thank you for coming. Yes. Thank you for choosing our clinic. You are coming from Denmark.
From Denmark, yeah.
Danish.
Yeah.
You are Danish, right? So please tell me how you find our clinic, our technique. How did you do that?
We actually started this journey with laparoscopy, I think it's called, embolization.
Okay, you write embolization in
No, we had a time in Denmark for embolization, but we heard about the success rate. It wasn't that great with embolization.
Yeah.
And then
when was your schedule? When was your booking?
It was actually 2 years ago.
Yeah,
I think.
2 years ago.
2 years ago, yeah.
Okay.
And
you didn't have it?
Oh, yes, I have the varicocele.
Okay, you didn't have embolization, right?
No.
Okay.
We canceled it.
Yeah, because you heard that there are some failure rates, some risks. Actually, embolization has some place.
Yeah.
I think the best embolization will be if an open varicocelectomy, microscopic varicocele surgery fails. Because in open surgery, we can deliver the testicle and finish the gubernacular veins, external veins very easily. In internal veins, it's tricky. We have to use microscope. We have to be very careful because we don't want to give harm to artery when we are trying to ligate the vein. Embolization working very nicely for these internal veins.
Yeah.
They can just go from one vessel, occlude it, stop the blood flow, and all the internal veins treated. But as they cannot reach the gubernacular veins, when they stop the blood flow in the upper part, the pressure increases in the veins and they find some new route from the external or gubernacular veins. That's why it's have the capacity to fail. So then you see our videos, right?
I saw your videos and
on YouTube.
In YouTube?
On YouTube, yeah. And first it seemed to me like, why do I need to go all this way to Turkey? But then I realized, okay, it seems like you got pretty good control on what you're doing. Yeah. And in my situation, I had one testicle left.
Yes.
So then we.
What was the reason you have you lost your other testicle?
Oh, it's a long story. I was born with it up in the stomach.
Upper part, up in the stomach.
And then it came down.
Yeah.
When you got a little bit older.
Yeah, I got a little bit older. And
If it
started to pain.
If it was in the left side, you would be more lucky because varicocele very rarely happen in the right side.
Yeah.
So if they take out the left testicle because of this undescended testicle, right testis remained, it will not have varicocele.
No.
But you had you had the right testis removed. So when you have only one testicle, we call it solitary testicle. The blood flow into testicle is more because it's working for two testicles.
Okay.
So it's very hard working testicle. A lot of blood is coming to that area, and your blood flow is also very nicely. Arterial supplies is very nice to your testis. That means a lot of blood comes, so a lot of blood has to go back, and the veins sometimes are not enough, and they get larger and larger. Yeah. That was what you have. And what symptoms did you have? Any pain? Any sperm quality decrease?
Actually, my sperm quality was extremely good.
Yes.
Compared to other people.
Yeah.
But when I had any form of physical activity, when it was really bad, even going to the toilet and straining, it hurt a lot.
Yeah.
And sometimes if I had a long day at work, standing up maybe with my colleagues, I could start feeling it then.
Yeah.
So yeah, it was typical. And when I laid down, it disappeared.
Disappear. Very good sign that it is because of varicocele.
Yeah.
And your testis is hardworking. It is doing the job of two testicles.
Yeah.
So it was the volume was good, blood flow was good. So your sperm count is good, no problem.
Yeah.
But now it has too much blood inside, and when it needs to drain the testicle, you had this varicocele. And actually, if you didn't have the pain, we would not operate.
No.
And if you have the baby, how old are you now?
21.
21. So if, for example, in what age usually you are marrying in Denmark?
Oh.
Very
30,
long time.
30, yeah.
30, around 30. And so you now eliminate the risk of decrease in sperm count, which is good.
Yeah.
Because even your sperm count is very nice now, in the future it may get worse.
Yeah.
So we eliminated this risk too. And the pain, now you had the pain of the operation.
Yeah.
We have this cut in the inguinal region and a lot of trauma in the testicle. We worked there too much. Can you feel any difference in the pain type, or can you comment on this?
The pain is only in the scar now.
Only in the scar
Only
now.
the scar.
Yeah. So it's, of course, you need to strain to make some exercise to see that it's not coming back.
Yeah.
But I am sure we finished it because the operation was nice. I am very satisfied with the operation.
Yeah.
But you will need some straining exercise. For me, the solitary testicles, one testis patients, are really risky and really difficult because their blood flow is too much. And we need to stop the exercise for a really significant time. Exercising, straining is my worst enemy. Okay, so if someone has to do weightlifting exercise, such things, I want them to do somehow without increasing the abdominal pressure.
Yeah.
For example, for biceps, you may put here and work like here, and work like this, and don't increase the abdominal pressure. Don't do any sports at least for 4 months if possible. Sometimes professionals come to me. One of my patients next week, he's a gym coach. He says, I have to go back after 3 days. Risky, of course, but this is his profession. Maybe he will need another surgery. Maybe he will have recurrence, but he had to do it. But for normal people, I don't want to do this heavy exercise at least for 4 months. After 4 months, for solitary testicles, we have to be careful. And I want you not to do these exercises. If possible, 6 months. If possible, 1 year. But of course, I don't want you to get fat, like you are not slim now, sportive looking. But you can do like cycling, like running, other sports. Swimming is the best, of course. And in Denmark you can swim in the sea. It's very hot country, very nice.
When you were there, it was hot, yes.
I was very lucky. I went to Denmark, it was in September.
Very lucky.
Still it's 24 degrees. And my wife prays a lot before going such visits. We never see a raining country in Europe. She is always praying.
Very lucky, yes.
Then yes, so this is good. I'm satisfied. And for the travel, what's your comment? How difficult it was?
The travel down here was no problem. We booked a direct flight. It was 3 hours and 20 minutes from our airport in our part of Denmark.
Your airport is in the city. Our airport is.
It's
30 minutes from our.
It's close, still closed.
So I drove there.
In the south, I know. In the south of the city. So do you live in Copenhagen?
No, it's the other part of Denmark.
Okay.
The big part.
Okay, the other part, the surfing side. I know.
Yes.
I like it. So. And so when you come here, how did you find the hotel?
Well, we booked the hotel before we flew down here.
Yeah, from internet, everything from internet, right? Sometimes people ask me to have some company who will deal with all of these. I don't want it because they always have commissions. They ask for commissions, and for your travel and for the transfer from airport, from hotel. Maybe in the future, if I find a good company, I will do it. But now it's what's the total cost for you? You had the operation in the expensive hospital.
Yeah,
so the total cost for the travel.
Well, it's when you live in Denmark, it's a little more expensive to buy plane tickets because the economy is pretty well up there.
Yeah, it's very everything is expensive in Denmark.
Everything is expensive, but as long as you
So you can save some money if you have this operation every time in Turkey. You can save money.
You can save money on the operation.
On the operation, of course, but for the total cost, maybe also cheaper than.
I think, and both plane tickets for me and you,
and the operation.
and the hotel was it 6,000.
Yeah.
Yeah.
6,000.
Around 6,000. And I think if someone comes alone, you are with your girlfriend, and someone comes alone and chooses the most economic way, they can really do it around 300 plus flight fee. So you can find really cheap options in Turkey, and the hospital that we are operating, the economic hospital, is 2,000 euros. So it's good. Euros or US dollars. These are very similar. Sometimes people say, "Hey, you said US dollar, you said euro." No, I don't mind. It's very close. So you can consider it as US dollars too. So it's good that we finished it nicely, and now we will be in follow-up. In follow-ups, I use internet as usual, and you will text me when you arrive. After 1 week, after 1 month, so we will be in touch. Thank you for coming.
Yeah, thank you for making the operation. We appreciate it.
Do you recommend us?
Indeed. 5 stars.
Thank you, my friend. Thank you.